If you're experiencing memory issues that are affecting your everyday life, it may be time to ask for help. Here at Neurology Care, they pride themselves on a team approach, which means not waiting months to see a doctor. Let's talk about seniors. What are some of the common health conditions that you see as people begin to age?
Well, one major thing with aging is memory problems. Now, aging doesn't mean that you lose function, but when you start having balance problems, when you start having cognitive decline, start having behavioral problems, personality problems with memory, then we have a problem. And these are signs that we do have probably a neurological disorder, and this is medical that needs to be evaluated. Life expectancy in the US has been going up, which means we have better health care, we tend to live longer. But this comes with an expense, that we're gonna see more dementias that comes with age.
If that person is able to do these activities or not, that's usually the criteria that we use as to designate whether this is something that is age-related change or this is more pathological. If the patient is able to maintain their activities of daily living, then that's more likely we're saying that's simple, just aging process. Once the minute that they start to develop any difficulties with their activities of daily living, then that's when we start thinking of, okay, let's do a little bit more workup. Let's see if this is a true pathology or a disorder.
The earlier you come for an evaluation, the better the outcome. Because what we do is we do an evaluation, look for anything reversible that might be contributing to the memory problem. There are some medications that can help slow down the progression, and there are other tools also to improve the quality of life.
There are things and steps that you can actually take in order to be in the driver's seat. Exercises, healthy diet, sleep. Sleep is very crucial. So if you're maintaining a healthy diet, if you're really exercising pretty well, if you're sleeping very well, these are the measures and the means and the tools that can actually prevent having any neurological conditions or disorders or diseases.
We established more of a team where we're growing our system to be very efficient, where we can get those patients ready, try to see them early. They need urgent help. Cannot wait 6 and 8 months.
And so you're about 2 or 3 weeks out if somebody were to call and want an appointment.
Yes, and we try to keep it that way.
We work as a family, as a team. We spend a lot of time with our patients. We want to hear their stories. Our biggest goal is to form a plan for the patient and just make sure that we're giving them the best chance to keep them as independent as possible. It's not about finding something wrong. It's about maintaining the patient's and the person's independence and confidence. Confidence in terms of, as I said, you explain the symptoms to a patient, and once you tell them that this is normal, this is part of aging, the instant confidence that the patient has, that's where you actually maintain their confidence. Don't feel afraid. We're here to help. We're here to support. Our biggest goal is to maintain your confidence, make sure that you're fully independable as much as possible, and put your mind at ease.